What's up YouTube? It's Steven from Steven and Tosh, and I'm here with another video, the top 5 questions that are asked by aspiring medical students. It's funny, I can remember 20 years ago when I was in the process of applying to medical school and all that, some of the questions I had, and I went on the website, the same website I looked at 20 years ago, and it's still there. It's much improved, but I looked and I saw the questions that were being asked, and it's amazing. It's the same questions. So after 20 years, the same questions are being asked by those same students. And now being through the process, having gone through school, residency, and now a practicing physician, I think I can answer some of those questions with firsthand knowledge. So this video again, top 5 questions asked by aspiring medical students. Question number 1, how hard is it to get into medical school? Or more specifically, can I get into medical school? Now, if you look at these message boards, you'll have the person who puts down all their stats, their MCAT, their GPA, research if they have it, and they'll say, can I get in? Well, obviously, no one can actually give you the answer to that except the admissions board of your particular school. But you can give some good advice or maybe some help if they are lacking in certain areas. But for the most part, can you get in if your grades are decent, usually 3.5 or better? If you have MCAT scores that are decent, I'm not sure how they grade those nowadays. If you have good references, if you have a reference from someone who went to the school you're applying to, that's always good. And then if you have research, that's not needed. I had none, but also it can help a lot and go a long way in certain schools. And then your experience. I was a physical therapist prior to applying to medical school, so I'm sure that helped out some. So can you get in? Yes, if your grades are decent. But primarily it's work ethic and desire. If you really want it, you can do it. It's you may not get in the first time, but if you have that desire and you apply second time, you work on your grades. If it's low, a certain score is low, you need to get it up, then you go back and take it a second time. Things like that. If you have that desire to do that and are willing to put in that effort and that work, then yes, being a doctor is attainable to anyone. Question number 2, how difficult is the MCAT? Well, unfortunately, I can't give much input on that. It's been, like I said, over 20 years since I've taken it. But I do recall that it didn't seem to have much to do with actual science, actual knowledge of science. Because I remember all the organic chemistries and microbiologies and all the prereqs you had to take, but I really don't recall it having much to do with any of that. So I don't know if it's challenging more how you think or problem solving. I do remember an essay, but short of that, I'm probably not the best one to ask that question. You would probably be better served going on those message boards to people who have recently taken it. They can kind of give you an idea. I assume if you're a good test taker, you'll probably do well. So I guess it's probably like the ACT, SAT in that respect. But for the most part, I don't recall it testing much of my knowledge of science. So it's best to probably speak with someone who has taken it recently. Question number 3, how is the lifestyle of a physician? That's going to depend largely on the specialty you choose. And then with that, it will depend on the type of working environment you're in, whether you're employed in a group, small group, large group, you're working for yourself, your own private practice, how much money you plan to make or want to make. All those things kind of play a part in how much you'll work. Also specialties, some specialties have a much easier lifestyle. Some have a much more hectic lifestyle. I'm a general surgeon, and the misconception is that general surgeons are working all the time. And that could be true depending on, again, the type of practice you're working in. If you're working as an employed surgeon, then you have a little more of a set schedule. You're still called in at night sometimes, and when you're on call, your schedule is relatively unpredictable, but when you're off call, you're off call. If you're private practice, you're almost never off call unless you have someone covering for you, because your patients are your patients no matter the time or day. Lifestyle can be good. It all depends on how you want to make it. It could be hectic. Again, some people like it that way. So depending on the specialty and the type of work environment you're in will determine that, which is entirely up to you. Once you become a physician, once you finish your residency, you choose how you want to work. So you can choose your lifestyle you want to have. So it's not necessarily a hectic lifestyle. I have a lot of free time, and my lifestyle was really good. So question number 4, how much money do you make as a doctor? Well, obviously that's going to depend on the specialty. And again, like we already talked about, depend on how hard or how much you want to work, which of course impacts your lifestyle. But this can be found this day and age. You can go to Medscape, and every year they come out with a survey of physician salaries based on specialty, even break it down further to if you're employed or in private practice, if you're male or female, and they break down a lot of other things as well in that. So that will be the best source for that. Medscape, I believe, is who it is, and they do a yearly breakdown of salaries based on specialty and such. And question number 5. DO versus MD. What's the difference? Which should I choose as far as what school should I apply to? First of all, you can refer to the previous video talking about what is a DO. I kind of speak a little bit on that in that video. But for the most part, as far as out in the real world, once you become an attending physician, there's no differentiation made between MD or DO. As far as job searches go, I've never been asked anything about it. I've been interviewed by hospitals and clinics who are primarily MDs. In fact, I think all of my partners except one have been MDs. So it's not something that's even talked about or thought about once you're out. It's commonly a question that you get from medical students or aspiring medical students because they just obviously don't know. And you hear certain things which are usually completely erroneous, but it is what it is. But in the real world, when you're out practicing, there is no differentiation between the two. And as I said, even as far as patients are concerned, I've gotten asked maybe once or twice, what is a DO? But it's never been an issue of they didn't want to see a DO. It was just, hey, what is that? I really just noticed that recently. And these are patients that I've usually already treated or done surgery on multiple times, so they're completely happy with their services they've been provided. They just were curious. As far as what school should you go to, should you apply to MD or DO? I think your goal should be to be a physician. And if that's your goal, then you apply to whatever schools are in your area or whatever schools you feel like will most benefit you. I don't think a DO school is any less difficult to get into the MD school. I think they all have pretty stringent requirements, and if you meet those requirements and your goal is to be a physician, then I don't think you should focus on one or the other. I will say that DOs or DO schools do tend to more likely they will take a untraditional student. So a student that is not fresh out of college with a BS in biology and they come and they apply right out of graduation from college. I myself worked for 3 years as a physical therapist before I even applied to medical school, so I was untraditional in that respect. But I had a guy in my class who was 45 years old, so and another couple of women who were in their late 30s, early 40s. So DO schools are more more open to taking the non-traditional student, from what I've been told. Now, I'm not sure how MD classes are these days as far as who they accept, but I know in times past that has been what was said. So there you have it. Those are the 5 questions most commonly asked by aspiring medical students, and those are my 5 answers. Subscribe to the channel. There'll be more content like this coming. So if you are an aspiring medical student or a medical student or even a resident, I have a video coming up specifically for those as well. And subscribe, hit the like button. Most importantly, hit that notification bell. That way, when a video is posted, you'll be alerted to it. So again, Stephen and Tosh, we'll see you later.